Is your coder your friend? Are they the ones you need to trust 100% in the billing and coding decisions? There are many intricacies in that. So listen here and be careful, because this is very important, and this is part of our physician productivity series. First, what is the level of education of the one in charge of your billing and coding? From a medical standpoint, gosh, very little, maybe from high school. They may have gotten a bachelor's or even a master's in billing and coding, but not in medicine. So they do not understand the medicine as you do. They understand what is billing, what is coding, what are the CPT codes, what are the ICD-10 codes. All of the coding guidelines, yeah, they are the pros in that, but not in the medicine. So you need to know that very well. They cannot tell what is the risk unless you specify the risk in your note explicitly and clearly for them to understand it. So when you talk to them, you need to understand from where they are coming and from where you are coming. You are looking at different pieces of this big thing, which is the billing and coding. Second, which is very important, what is in their best interest? What they're gonna make them happy, and does it align with you or not? What is in their best interest is to avoid audits, and if they get audited, that they stand it. That is what they are really looking for. They are not there to support you to build the max you can. No. They are there to make sure that the charges are correct, and if they are incorrect, to ensure that you're gonna fix it so that you don't get flagged. In the world of billing and coding, it goes with averages. What counts as high complexity for you may be very different from the coding guidelines. The coding guidelines are set to be universal all through the US, and there are no negotiations around it. The Center for Medicare and Medicaid Services, CMS, will decide what counts as low complexity, moderate complexity, and high complexity. And we all abide by these rules. And they try to make them as explicit as possible to minimize the confusion and make sure that we all speak the same language. If you go to Statistics 101, you're gonna find the inverted bell curve. You got outliers, whether low or high, and most of the people are in the average. And when you do that, you will not get flagged, and you will have a smooth sail. The problem when you start charging high complexity, because then you may get flagged, and when you get flagged, you will get audited. And when you get audited, if you fail the audit, you may need to pay back. Why does your coder fear audits? That's a very important question for you to know. Let's take an example here. Let's say one of the common insurers you work with sent you a letter in the mail saying, Dr. X, would you mind sending us 30 notes for the patients you see with us? And you send these notes to them, and they review them. And they can come back to you and say, you know what, among these 30 notes you sent us, 70% were overcharged. They should have been moderate complexity, and you charged high complexity. If you charge low complexity, you're fine. No one gonna audit you. They really appreciate your work and help because they pay less money. And money talks here. The less money they pay, the happier they're gonna be. But let's say that you think that you master your billing and coding, and you are charging much more higher complexity. If they come back to you after auditing the 30 notes and they say, you know what, 70% of these notes were overcharged, and the average overcharge amount that we paid you is $50. And you saw 5,000 patient encounters of our patients in the past 5 years since you started contracting with us. So keep in the back of your mind here, they are going in retrospect from the beginning of their relationship with you. So they are not auditing all of that period of time. They are auditing tiny bit and extrapolating all of this information to actually all of the patient encounters. So they did the math, and they said, you know what, 5,000 patient encounters. You overcharged 70% of them. This comes to 3,500 encounters. And the average overcharge that they paid you for that is $50. Let's do a quick math here. 3,500 by $50 per encounter This comes to 175 grams that you need to pay. And you will pay them to settle this issue. And there is no joke about that. That's why your auditor and coder will be very reluctant to see you overcharging or charging by higher complexity. And they tend to be kind of more stringent in the criteria with you. Now, this is one way of thinking about it. The other way of thinking about it, let's think about your specialty, whether you are in medicine or surgery. Will you reject seeing a complex patient, or are you going to celebrate seeing them? Will you try to help them, or are you going to be fearful of the liability and complications? We spend many years in medicine. We should be doing our best, and we strive to help patients the best we can with what we got. And many times we have difficult discussions with the patients, and sometimes we can go to procedures that can be high risk. But we have the discussion, and if the patient agrees and we have the skill, we move forward. And many times we get excellent outcomes. So we should not be fearful in medicine as long as we know what we are doing. The main problem when we don't know what we are doing. And that's why it's important that the question is, are you getting all of your information about billing and coding from your coder, or you are getting it from those who are very experienced in billing and coding as physicians to do that? A question for you, do you know why billers and coders don't have physicians among them? Because the job doesn't pay as much. And the hourly rate for physicians is going to be much higher. They cannot afford that. And that's why non-physicians are in billing and coding. And they are great, don't take me wrong. I love many of my billers and coders, and I email them back and forth all the time so that they can help me, and they do help me. But you need to have your own source of knowledge to know how to master it. Let's talk about internal auditing. The example I gave earlier is an external audit, when the insurer decided to audit your notes. There is internal auditing. And in the world of internal auditing, your auditor or coder gonna look at your notes and tell you, you are doing great, or maybe you need some help, or you need to get better. These internal audits are very beneficial because if the phrasing is not clear, it is an opportunity for you to learn. If I am in your shoes, I will not be fearful of audits. Actually, I'm going to invite them and celebrate them because these are my opportunities to get better. And if you can improve your billing practices, if I am in your shoes, I will not fear them. Like we do in medicine, we don't go by fear. We go by knowledge, and when you know what you are doing, you always get to learn. We are not perfect, and we will not be perfect, but we can always get better. And this should be your target and what you strive for. And even if we do mistakes, and if we pay for these mistakes, that's okay. It's fine, because I got to learn, and I'm gonna continue to do better. So don't let these troubles hold you. There are two ways of doing these internal audits. I remember during my training that someone in the informatics world decided to implement an AI-based tool in the chart to assess the note and decide the charge and code accordingly. And I was very resistant to that. And the idea of being resistant is that this tool will not teach me how to recognize the complexity, and if it qualifies for higher complexity, that it's going to tell me so that I improve myself. No. It's going to be doing its best to undercode, to stay safe, and not to go into audits. That's bad. You need to know the medicine, you need to know how to recognize the complexity, and based on that, this is how you put your charge. As for the actual billers and coders who look at your notes and audit them, they exactly do the same. They say, you know what, you charged moderate complexity, but this should qualify for low complexity. You charged high complexity, but this should qualify for moderate complexity. They don't give you the tips and tricks of how can you improve your billing and coding. And the problem is that if you are getting all of your coding information from them, you will not learn. How can you increase it? That's why it's important to go to the gurus in that field and learn from them. It was very valuable to me when I emailed my coder. and I add them. Does this qualify to high complexity? How can I do it in a better way? And I send just a copy of my note. Or looking at you performing an ultrasound. Does this template capture everything I need for the charge? This gets to be extremely beneficial because they are the experts in the phrasing and wording and looking at the specific guidelines and tell me, you know what, you need to change this phrase. You need to have this specific word. In the world of billing and coding, you don't go by emotions and you don't go by estimations. You need to be extremely specific and just copy and paste the phrasing that they have in the guidelines. And you need to go there and check it yourself. And it is good to have another pair of eyes to do that. And my coder has been phenomenal, that she actually introduced new codes to me, which I was not aware of. And I have been using them in my practice and they have been great. So your coder can be extremely valuable. If you like the content of the channel, please subscribe, like, and share so that you don't miss any of the future videos. And let's go back on track. In many instances, I actually asked my biller to randomly audit my notes and tell me what am I missing. And they came with valuable feedback. But the one difference that can make all the difference, that if you know the guidelines, you can fight back. And this gets to be very valuable because again, we are looking at the same animal, but from different sides. Imagine looking at an elephant and we are all blindfolded. Someone is holding the trunk, someone is holding the foot, someone is holding the tail, and we are trying to describe what we are seeing. You're gonna find very different descriptions for the same exact animal because that's true. We all have different points of view. When I was audited a while ago, I got 97% in my coding guidelines. I looked at the missing 3%, and it was an updated regulation from the American Medical Association. And this is when I shared my source and why I charged it that way. And the auditor was very reasonable, and they looked at it and they updated their knowledge. I was able to do that only because I keep up to date with the coding guidelines. A second instance happened when the code G2211 came back in early 2024. I started charging it and the coders got a bit hesitant because it was mainly for primary care physicians and few specialties. And we had a big meeting and every one of us shared their piece of knowledge and we were going back to the same CMS guideline. We reached a middle ground eventually and things went great, but without you as a physician going to the actual guidelines and understanding them, you have no chance of fighting back. And I'm not saying fighting like a quarrel, but I mean an open discussion with a pool of knowledge, and we as physicians add in meaningful information to that pool of knowledge so that all of us reach a great decision that is satisfactory to everyone, to the physician and to the coder and biller. That's extremely important for you to succeed and thrive. You may ask, why is the headache? Why should you charge high complexity and not just stick with the moderate complexity? And I'm glad you asked this question because it's a very important question. You may be an employee and usually you're going to be work RVU based, or you may be in private practice and what you care about is the collections from the insurance company. Let's take an example for you just to get an idea of what I'm talking about here. If you are seeing a patient in your clinic and you are charging moderate complexity and its CPT code is 99214, if you are employed by an institution and you go by work RVUs, right now in 2025 you will get 1.92 work RVUs. If you are going by collections, let's go with simple numbers, and the collection varies a lot among different insurers and localities and states, but let's say it's $120. So now 1.92 work RVUs or $120. If you charge high complexity for that same patient, now instead of 1.92, you went to 2.8. This is almost 50% more. If you are going by collections, on average, You went from 120 now to 160. That's a big difference. In the world of work reviews, having like 45-50% more revenue, that's huge. Or having like 30-40% more in collections, that's huge as well. If you are doing it right, if you can stand the audit, and you can prove your point and your documentation clearly describes it. So don't underestimate that. We got a lot of medicine to learn and master during our training and early on as attendings, and it continues to be a continuous learning process, but you built a strong foundation. Now is the right time to build the foundation for your billing and coding. That's why I wrote my book, Physician Revenue Secrets, to go in depth in the billing and coding guidelines. And also, if you check my website, www.mdefficacy.com, you will find valuable resources, and you can check my previous videos as well on there. I'll continue to create content to educate and shed the light on this very important topic. You need to master your business. And last but not least, the guidelines change all the time. It is very important to keep up to date every year with the new coding and billing guidelines. And this is why your biller and coder are extremely valuable resources. They are on top of that. They're gonna tell you what is happening. And if you sign up for the CMS newsletter, you're gonna find it very useful as well, because they're gonna tell you what is going on, what are the new physician fee schedule guideline updates. It's great. So stay on top of your game and keep up the great work. And now think about the billing and coding until I see you in the next video. Thank you for watching.